Studies show that one of the most important aspects of breast cancer survival is maintaining a healthy lifestyle. That means eating healthy foods, reaching or staying at a healthy weight, engaging in regular physical activity, and working with doctors on blood pressure, cholesterol, and any other chronic conditions. At the University of North Texas Health Science Center, one faculty researcher is helping to impact the positive outcomes of African American breast cancer survivors through healthy lifestyle approaches. Dr. Rahim Paxton, Assistant Professor of Behavioral and Community Health, is implementing an evidence-based website and developing print materials to help these survivors improve their overall health and well-being. This project is funded through a National Cancer Institute grant called the Mentored Career Development Award. Working with Dr. Paxton are top researchers from around the U.S., Canada, and Australia, specializing in epidemiology, cancer survivorship, health disparities, and sedentary behavior. Dr. Paxton is also supported by UNTHSC School of Public Health graduate students who assist on the project and related community outreach as they gain hands-on experience toward their careers.
The title of my research is Lifestyle Interventions for High-Risk Cancer Survivors. Our research entails collaborating with community-based organizations such as the Sisters Network to recruit African American breast cancer survivors. The Sisters Network is the largest African American breast cancer survivorship organization in the country. Initially, the study started off by conducting a needs assessment survey of approximately 475 African American breast cancer survivors. So we identified an evidence-based program called a lifestyle intervention via email. We're currently enrolling African American breast cancer survivors in this web-based study. However, we're in the process of expanding the study to include both women and men of every race, ethnicity, and cancer diagnosis.
Previous research has found that African American patients experience the poorest breast cancer outcomes that may be remedied by healthy lifestyle choices. And the Centers for Disease Control reports that approximately 4 out of 5 African American women are overweight or obese, and that just 36% meet physical activity objectives as determined by the CDC. Yet, despite evidence that these women are at increased risk for poor cancer-specific outcomes, they are often underrepresented in clinical trials promoting positive health behaviors.
There are special concerns for African American breast cancer survivors. They're more likely to be diagnosed with estrogen receptor negative or triple negative breast cancers, which are associated with higher rates of recurrence, lower levels of survival. Their condition is also less responsive to therapy. So it's really important to identify these individuals early and try to change their lifestyle behaviors by helping them to reduce weight, increase physical activity, because the literature suggests that physical activity could reduce the risk of recurrence and improve overall survival.
So what is the timing and what are the steps involved in this project? Where does it go from here?
The process starts by collaborating with JPS and Texas Health Resources and identifying African American breast cancer survivors who are eligible from the study. For those individuals living in the Dallas-Fort Worth area, you bring them in for health screening. We provide them with an assessment of body fat and bone mineral density with the DEXA machine. We also conduct exercise and stress VO2 max testing. This consists of putting the participant on the treadmill, monitoring their heart throughout the process, and pretty much seeing how fast and how hard they can go on the treadmill. Once the health screening is over, we then provide them with access to the Alive portal. What's unique about Alive is it consists of automated telephone calls as well as emails that the participant receives on a weekly basis. The participant has an option to either go to the website or respond directly from their email. So initially, they come to the website and participate in a needs assessment of their diet and physical activity behaviors. That needs assessment will pretty much group the individuals based on their level of risk for specific behaviors. So if they're not meeting current guidelines of physical activity or fruit and vegetable consumption, the website will recommend that they set goals to change those behaviors. The website also includes components such as automated phone calls and weekly emails.
Through this new program, it is the hope of Dr. Paxton and his team to improve cancer survival rates among this population.
We're in the process of expanding the study to include additional institutions and individuals who don't live in the Dallas-Fort Worth area. Our research is helping to create solutions for a healthier community by providing disadvantaged women with access to tools and resources to change their lifestyle behaviors with the intention of improving their overall health and well-being. So this is a vulnerable population who are often not included in clinical trials.
From our own hometowns to around the globe, public health is changing the world. At UNT Health Science Center, we work on solutions for a healthier community.